The diagnosis of psoriasis is fairly straightforward. This is a condition that dermatologists are very familiar with. So in the vast majority of cases, our diagnosis is clinical. We look for the typical red scaling plaques and thickened skin over elbows and knees. We ask patients questions about their disease, and generally we can diagnose this clinically without needing to do a skin biopsy. However, sometimes presentations are atypical and we will do a skin biopsy to verify. Patients really vary in how they respond to their psoriasis. So some seem to be in denial, they ignore it, they are afraid of the treatment options, or they're afraid to know what it really is. Sometimes they actually think it's something worse than it is. And so they may delay seeking medical attention for this. However, there's a lot more awareness now about psoriasis, and patients tend to have some idea of what it is. And by the time they reach a dermatologist, generally they do know what they have, and they're interested in treatment. There are a lot of examples of drugs that work out there. Most people will have known somebody with psoriasis if they ask around enough and find out that there are often very good treatment options. This can be treated. They don't have to live with this. There's probably not quite enough awareness about psoriasis. There are studies that show that this is still a very undertreated disease. There are patients with severe disease who have 10% or more of their body covered with psoriasis who are either not getting treatment or are getting treated just with topical treatments like creams, which are helpful in limited psoriasis, but not a good option for somebody with severe psoriasis. The reason why it's important for patients to know about this and seek treatment is that, one, they can have a much better quality of life. Two, psoriasis is not just a disease of skin. We now know that patients with psoriasis are at increased risk of having cardiovascular disease. They're at increased risk of having cardiovascular events. And so it's important for us when we treat our patients to also counsel them about this and to make sure that we're looking at their risk factors and making sure that those are being treated as well.